Welcome to my channel, or welcome back. I did an Instagram live with a doula and student midwife. I just wanted to share it here. I know that I said I don't want to share a bunch of COVID videos right now during this time for the sake of my mental health. This is kind of different because I'm not going to edit it and I'm not going to have to refer to a bunch of sites for research and further make myself more anxious. I want to stay informed on everything going on. I want to be able to help people, but at the same time I need to look out for myself. And when editing a video, a lot of research goes into my videos, so I don't want to be sitting here researching the coronavirus for, a week or however long until the video comes out. But doing this Instagram live was helpful to me because it's a way to help other people who are asking me questions, and it's a way to get resources and information out there. So I like that I don't really have to edit this video. I can just add it to this video that I'm making right now and share it as a big video here on YouTube. I have never really gone live. I did go live like once last year with Badass Mother Birther, and I may have gone live like one other time, but other than that I don't go live. I like to pre-record things so I can see what I look like and I can edit out what I say. I'm really bad at talking on the spot and I really want to learn, so this live is by no means perfect, but it has a lot of good resourceful information in it that I think you all could benefit from. But again, this is a disclaimer, I'm really bad at talking to people. I have a lot of social anxiety and I need to learn how to interview people, like when we're both talking back and forth as opposed to sending out interviews through email. After watching my live and cringing for about 25 to 30 minutes, I really criticized myself. I was afraid of everything that I said, and I didn't really like what I said and how I came off. I want everyone watching to know that not everyone has $3,000 or however much money lying around. Midwives are amazing and it's wonderful to be able to utilize that sort of support. Midwives 100% deserve every penny. I totally understand how difficult it might be for anyone to be able to afford such things. I remember when I was pregnant and I was really worried about paying a midwife, people were like, oh, just use your tax money, just take out a loan, just drive for Uber, just do this and that. But it wasn't that simple for my life. It wasn't easy paying that. It took me about a year, maybe a little bit longer than a year, to fully pay off my midwife, when I think it takes most people about 9 months. And my midwife really trusted me to be able to do that, and I trusted her. But I think that's where communication is really key when you're hiring someone. So I remember going back and forth with the idea, am I being selfish because we're paying for something that we really can't afford? And I would cry every night about this. I was so worried that the alternative would be going to a hospital or birth center, and really that doesn't sound so bad. But in my case and with my experience, I was terrified to go to either place. I really wanted this home birth, and I'm glad that I did it, and I have no regrets. Don't take advantage of midwives, okay y'all? That's just not cool, and that's not what I'm saying to do. I'm saying if you cannot afford one, talk to one. See what you can do if you really want a home birth. I understand though, it's not easy for people to just use all of their tax money and pay for things like this, because there's a lot of other expenses that some folks might use their tax money to pay off. So there are ways that you can afford a midwife. There are things that you can do to help pay for a midwife, but also just please be open with your midwife from the get-go, and don't be afraid to reach out. I think that's the whole point of our video. Don't be afraid to communicate with whoever you want at your birth. This is your birth and your experience really matters. Without further ado, here is our Instagram live, and I hope that it's helpful. This is Jessica Ervin. She is my student midwife and doula friend, and she's gonna help me answer some birthy questions for you all. Do you want to go ahead and maybe we can answer some? You also had a VBAC, right?
Yes. Yeah. So any VBAC related questions, I'm all about.
And you had 2 VBACs or?
Three, well, 2 at home and 1 was transferred to the hospital, but yes, they were all planned at home, but.
That's awesome. We're talking today due to the increased anxiety around giving birth in hospitals due to COVID-19 and everything going on. So what are your thoughts about people who are considering home birth during this time?
So we've definitely been slammed. When I say I'm meaning me and like the midwives I work with. Everybody's getting tons of increased amounts of inquiries. Everybody wants to know what are their options right now. And I think that's, great thing to do. Everybody needs to ask and find out the people that are kind of just jumping to unassisted birth. I'm totally not against unassisted birth. It's just, I feel like it's hard when it's out of fear, when we feel like we're forced because we're too afraid to go to the hospital. That's a hard place to like go to. So I definitely want people to know that they have options here.
Yeah.
That home birth is an option either with nurse midwives or certified professional midwives, CPMs. There are options here. So. And
I have to agree with that because I understand that some pregnant people are like 37 weeks and considering unassisted birth, and where there's nothing wrong with unassisted birth, they're just now considering that, going from hospital straight to that. And there's a lot of planning and education and, finding a birth team and support that you might want to put together just to make it be a better birth experience. So I definitely agree with that. And there are options and there is support out there. So don't think that there isn't support. Because midwives, they got your back.
Yeah,
okay.
we feel it. Everybody feels it. Yes, we know this is a stressful time for a lot of people.
I had a lot of anxiety about giving birth at a hospital, so I totally understand the anxiety aspect about giving birth in a hospital, but not during a stressful time like this. And I think that it would be really scary to plan for something at a hospital and then just have to go and be too afraid. So I understand that. And your fears are definitely valid, but again, you all have support. So what is the difference between a doula and a midwife? Because people get these confused quite often. Well, so as a doula, I will still attend your home birth, but a doula won't do the medical side of things. We provide a lot of emotional, physical, all that kind of support, education, everything like that. But the midwife will do the more clinical things, and the whole actually catching your baby. The doulas are not supposed to do that part. So, and a midwife is the whole holistic care and postpartum, and okay, it's just a more encompassing with a midwife than your doula. But I feel like a doula is there more like through the pregnancy for you to reach out and ask questions to, like even things that you might not feel like, oh, I should ask my midwife. Just, how are you feeling today? Checking in with your doula and, just helping with the emotional part a lot more. Yeah, sure. Doulas are really important to have and to ask questions with. And they can help you plan for things and look into things that you might be interested in, whether it be VBAC, changing providers. They have all of that information. So, is home birth legal? So it is not illegal for you to give birth anywhere you want. There's no illegal repercussions for anybody, except for the actual trained professional, the midwife who would be attending, unfortunately, in North Carolina. Now, our surrounding states legally recognize certified professional midwives, but North Carolina doesn't yet. But they do recognize certified nurse midwives. There are a few options in North Carolina for that, for home birth. There's a couple near Raleigh, and it's harder over here, of course. And they do have a little bit more restrictions. Like they won't be, nurse midwives cannot take home births with VBACs. So. Yeah. How far would a CNM be willing to travel for a birth in North Carolina? Well, I guess it's up to their specific practice. I mean, most will do like an hour and a half, probably around where they're centered. Do CNMs typically take insurance, like Medicaid? Yeah, a lot of them do, which is really, really cool, and it gives a lot more options to other people. Most insurance, I think, like Blue Cross Blue Shield and Medicaid are two I know for sure, from what I've heard, that will be accepted with nurse midwives. So what is the difference between a nurse midwife and a professional midwife?
So the nurse midwife goes, well, obviously through nursing school and has her master's degree in midwifery. It's super awesome. They can also practice in birth centers and hospitals. And then a certified professional midwife, which is a CPM, they're specifically trained for home births and go through either a lot of rigorous schooling or like apprenticeship route thing where it's just a whole different accreditation. And
the school,
like I said, is
different.
Yeah. Mm-hmm. And then the CPMs are just not legally recognized here, whereas they are in other states, unfortunately.
That's really fortunate because I feel that there are way more CPMs in this area in North Carolina than there are nurse midwives that practice like home birth and can attend home births.
Right.
Yeah. How do you find a midwife in North Carolina? What would you do?
Right. The best way is to reach out to one of us or somebody you know that's a doula or a birth worker, and we can kind of point you in the right direction. Because unfortunately, we're most of the time underground, you know.
Yeah.
We don't just tell the names of the people who are not able to legally practice yet. So
yeah, it could get them in quite a bit of trouble. Right. So what is the cost of a midwife or a CPM in this area, or does it vary? It
probably varies quite a bit. I don't know in Charlotte specifically. I don't know everybody's price ranges, but usually around $3,000 to $3,500 for that's all your prenatal care, birth, and postpartum.
And they can do payment plans, right? Or some,
yes.
Yeah.
Yeah, a lot of times you're just putting down a deposit, and then after that, they're really willing to work with you on payments of whatever you're able to make. So that's super cool.
Yeah, in my experience, I saved $50 a week and would just like send it through like PayPal or whatever just every week, and it wasn't that bad. Some weeks were bad, but I would let my midwife know like around Christmas. I was like, we're having a hard time right now. I'm going to pay you with a bunch of change that I'm going to go get cashed, but we're going to pay you. So, and we got fun. It's just a matter of letting some things go, I think, that you don't necessarily need, and planning and saving.
Right. Yes, and we understand, you know, not everybody's able to come up with such a sum at one time. And especially right now with everybody whose, like, plans are shifting really quick and they're looking for something and they're not sure that they can make a big payment like that. Just know that we want to work with you on that. And, you know, don't let that be the thing that stops you from reaching out to us and talking about how we can work things. Yeah,
definitely don't try to go through this alone right now, because midwives are there for you, and I know that some people have been laid off of their jobs, and I think that everyone really understands that. So don't be afraid.
Fully. Yes.
So midwives in the area that do VBAC, I know that a birth center no longer is able to practice that, and a lot of people risk out of some places because no one will do VBAC. We have like one hospital in the surrounding areas that even takes VBAC clients. So can you answer some about that?
I used to send everybody to Natural Beginnings Birth Center in Statesville. I love them for VBACs. I still love them for VBACs, absolutely. But you don't have very many out of hospital options for VBAC anymore. Like I mentioned before, the nurse midwives are not able to take VBACs, which is super unfortunate. So yeah, really one of your only options is the CPM for VBAC birth. So, you know, reach out to one of us if you are really interested in having a VBAC at home. Yes. Hi, Caitlin. Caitlin's planning a VBAC and is looking at her options as well for out of hospital birth. She's just said hi.
Oh, how was it for you planning your first VBAC?
So, well, my first VBAC was in Ohio, and the options were a little bit more open there. But when I came down here and realized when I had my first VBAC here, I wasn't as connected with everything yet, and I didn't know all the options. So when I was asking around, I was trying to plan for a home birth with a nurse midwife, not knowing how hard that was going to be. I remember having a moment when I was like crying, oh my gosh, I'm not going to be able to figure out how to birth out you know, I just didn't know my options. I didn't have until I figured out, like somebody messaged me and was like, hey, CPMs will attend your birth, so reach out to this lady. So I was really excited about that. So
do you think there's a common fear with VBAC and like wanting to plan for one?
Yeah, so some people, you know, they have a lot more anxiety with VBAC. For some people, they'll feel more safe and supported in a hospital to birth. And some people have such a traumatic experience that just going into a hospital is going to be hard to VBAC again. Like, that was my experience. I knew that just walking into a hospital, I was going to feel all those feelings and not feel like I could, you know, give birth the way I wanted to. So yeah. I was like, I have to have this baby at home or, you know, outside of the hospital. Actually, a big driving force for that was watching The Business of Being Born at the time. So that was like 9 years ago.
Oh,
but
wow. I agree with that. That film really helped me plan for my home birth. And I think it was like one day, like after I found out I was pregnant, I found out like in April or May. And I think by July or August, I was like, I'm going to have a home birth. There's no way I can go back to the hospital. I don't think I can leave my house. I'm too scared. I'll back out. I planned to go to Natural Beginnings, and I love Natural Beginnings so much, but I was afraid that I would back out and end up giving birth in the car because I'd be too scared to walk in. So I decided to have a home birth, and I think a doula connected me to a midwife who connected me to another midwife, and then I found one that I really connected with. And it was kind of like dating, I guess, because I wanted to be in charge and decide who was going to be at my birth this time. I didn't want to just go. Someone asked about religion and midwives. They said some midwives seem really Christian-based, and they wanted someone that wasn't like faith-based. And does that exist?
Right. I think that's harder, especially being in the South.
Yeah, definitely.
Right. And I guess it's hard for me to discuss too, but definitely the midwives that I've worked with, even if they are religious themselves, seem like super open and supportive to to other religions for sure.
Oh yeah. And
exactly.
I'm not religious, and I had 2 midwives at my birth, and neither of them really, said anything relative to that. So that was kind of helpful. What I did like was birth affirmations, and sometimes that can get religious-y, but it wasn't. And what was said to me was actually super helpful. Like one midwife kept saying, like, ride the wave, don't let it crash on you, and just like pick yourself up, and you can do this. And it was really helpful. So I know it's hard in the South.
I feel like they kind of go with what you want. So if you want prayer and you want like, scripture and things read, they'll do that. And if you don't, you just want your birth affirmations read, they'll go that way too. I feel like that's a good midwife will not bring her own agenda into it.
Exactly. And I think that's where it's really important on the client's end to try and be really open with your midwife, whether it be your payment plan or like how you're feeling about something, or if you want to do something or her not to do something. I think it's really important that you're open with your midwife.
Yes, absolutely, for sure. They want you to have the birth experience that you're wishing for. They want you to have all the things that you're envisioning and everything. So they want to work with you on that, and absolutely. So.
And that's what's wild to me was I never met other people who were care providers that actually cared about me, and I felt very cared for during my pregnancy. Like, I'd never been treated that way at any sort of doctor's office or medical setting. So it felt really good to have what kind of felt like a family and a team. And
they actually sit down with you and they want to listen, and they want to, actually ask how you're doing.
Yeah.
And not just physically, but emotionally too,
Definitely. I talked to my midwife about everything, probably like really inappropriate things, but she listened. And like,
if you're not talking about your poops and your sex life with your midwife, then like, what is this? What's going on?
Right? Like, they've heard it all. So just probably ask before you like send a picture or something, though. Just kind of let them know first. Yes. But I have a very intense fear of vomiting, and that's something that I'm afraid to tell people because it's just embarrassing and it's like weird and no one really talks about stuff like that. But I told my midwife and she did not laugh at me, so I was very surprised by that. But I shouldn't have been because she's so sweet. But whenever I was pushing, I kept saying, I'm really afraid I'm gonna throw up. And both midwives kind of teamed up together, and one let me know, like, if you do, it's okay. You're still in control, and we're all still here for you. And then the other one also kept, like, letting her know, you know, she has a big fear of this, so we need to support her, like, in the best ways that we can. And that was really helpful. Like, I've never been that not afraid to throw up. I didn't throw up, but I felt comfortable if I would have. Yeah. So I wasn't, and that's big for me because, like, I'll hold it back until, yeah. So, yeah, always try to be open with your midwife, and they won't judge you, or they shouldn't. A good midwife won't.
Right. And if she does leave and go to somebody else.
Yeah, definitely. You can shop around. You choose who your birth team is. So another question was, do midwives provide birth supplies?
Well, we always try to have extras. So, like, if you didn't use everything from yours that you ordered, we gather those up and help other people who might be in need of them. But we do have, like, a list of, I hate saying we, like I'm the midwife, but I'm not. I'm just saying as a team, we do have a list of supplies you need to have per individual person, obviously. For their own births, because it's stuff like towels and trash bags and napkin, you know, things that, like, are one-time use for you guys, and we wouldn't bring that from birth to birth. Yeah. But we bring our own equipment, absolutely.
And some special stuff. What would be, like, some basic special care that maybe your midwife would only have that you may not be able to get on your own, that she would bring to the birth?
Like, well, our resuscitation equipment, obviously. Yeah. Some medications, tinctures, herbs, and things like that to help with contractions or bleeding or anything like that. We always carry those things as well.
Yeah, midwives don't just show up to your house, like, with nothing. My midwife brought a really big Mary Poppins looking bag. So
yes. Yeah, always the Mary Poppins things for sure. It's a bag with we have to have all the things for just in cases, you know, and then extras of that.
Yeah, and that's good. I felt really secure by seeing that. So that was helpful. So here's a really good question. What happens when a person reaches 42 weeks with a midwife, and how often does that happen?
I saw that question, and I love it because I went past 42 weeks with two different two different CPMs in the state. And so I had different experiences with both, but let me just tell you, neither one of them were pushy. And in fact, with my last, I went to 43 weeks, almost 44. And I never felt like, oh no, we need to get this baby out now. Yeah. There was definitely an increase, like, all right, let's check on baby every couple days. And because I am a student midwife, I had a Doppler. I was able to check, you know, when I was worried and things like that. But it's definitely less. It's not going to be the same as anywhere else. But we do still want to keep an eye on people who are going post dates that far.
I remember with my midwife, I think that was a question that I had. And she said, well, whenever you hit 41 weeks, we'll see what your options are and what you want to do and go from there. So, yeah, it's not pushy. And
it's not the fear. It's not the fearful place that you hear from the hospital. We don't believe in placenta. That placenta stopped working magically at 41 weeks. You know, we believe in women's bodies. We believe in people's bodies to give birth. You know, so we just don't have a fear around it like you think.
Here's another one. What would make a person risk out of a home birth? Is it different for every midwife?
Yeah, that's definitely going to be different for each midwife and what they're comfortable with, probably what they've experiences in, and, you know, what kind of things they're more fearful of, I guess, or just their specific regulations. a lot of things can be controlled diet-wise. So I mean, if we start to see something creep up, we're always like, okay, let's check diet. Let's go into nutrition really deep and see if we can correct things before, you know, it goes somewhere. And if it is going into the direction where we're not comfortable, then we'll definitely risk you out and either join you. Like most of the time, we would go with you to the hospital to give birth, you know?
Yeah.
But like right now, we can't even transfer with our clients.
Yeah, this is a really scary time for a lot of birthing and pregnant people right now.
Super unfortunate. I mean, we could obviously offer the virtual support, but it's just not the same. I mean, but it is helpful.
Yeah,
Absolutely.
it is definitely helpful. I like this one. Can I have a home birth in an apartment? Will it be loud?
I love it. All right, so you said you wanted to answer this one, and I think you should. That's awesome.
So I live in a garage apartment, and I have a house that's like super close to the garage apartment, and I can hear everything my neighbors are saying whenever they're outside, and I'm sure they can hear everything that I'm saying inside. And where my home birth, the whole thing itself wasn't loud because I was in early labor and then active labor, and both of those were very manageable. I did as normal. Then when I hit transition, things got super loud. And my plan for that was to kind of tell my close neighbors, you know, I'm okay, I'm planning a home birth. You totally don't have to do that. You don't have to tell anyone. But since I'm so close to them, I had a lot of trauma and emotional things coming up throughout my birth and throughout my pregnancy. So I kind of expected it. But yeah, just let people know. We put a sign on the door too. I think it said birth in progress, and my dad wanted to make people wear masks and gloves when they came home, so he like wrote that on the sign, but no one. But yeah, so we just let people know just in case anyone called the cops on us. But I don't think it's very likely to happen. You might get a noise complaint if you don't talk to people or put a sign up, so just be mindful of that, I think. So in
all the years of apartment births I've been to, I've never had somebody complain. And you're never as loud as you think you are. So everyone, a lot of times they're like, "Oh my gosh, I was so loud. I'm so sorry." At the end, and we're like, "Girl, listen, you were fine." Like it might be loud for that room, but I mean, you know, that your neighbors will be fine. And you know, if they knock on the door, we'll explain it to them. Otherwise, they'll mind their business for that short period of time, you know.
That's the worst that can happen, is that someone might check on you, and you can just be like, we're doing our thing. So
exactly.
Okay, so our next question. For an unassisted birth, what would you suggest for cord care and a suctioning baby necessary? And we talked about the cord care. I think this means how can you clamp a cord? What can you use? What are the options there if you're planning an unassisted birth?
Well, definitely you can still order a cord clamp or a cord band from Precious Arrows. They're based in Raleigh. It's a really good company. And, you know, I think that there's some good home birth courses for unassisted birth that kind of address what to do in that instance. But yeah, that's all I know. I mean, we do different things than you would probably do unassisted wise for the cord. We clamp and stuff, but of course we let everything finish pulsing, and we never, you know, clamp before it's ready unless it's necessary. Caitlin said something here too. Do you mind if I read?
No, please do.
She said, oh gosh, hold on, one way. It said if you get stitched up after birth at home, or any problems arise from birth at home, we have to go to the hospital, and will our insurance deny coverage for that? So the midwife is great at stitches, and I don't know if you had to get stitches, Ashley, at all.
No.
That's really good. But usually, I mean, we can do, I think I've seen her do 2nd-degree tears and all kinds of different wonky things with no issue or no problem. But after my first VBAC, I did actually transfer afterwards to get stitched at the hospital, and then went back home. I didn't get admitted. I didn't even bring the baby. I was only gone like 2 or 3 hours, and then I came back home.
That's not bad.
So,
Were you nervous going back to that place though after your birth, or did you have that birth high?
yeah, I was on a total birth high because I finally had my baby, right? And I worked really hard to do it without any pain meds and all the things. And so they wanted to give me an epidural anesthesia to do the stitches because I tore that bad. And I was like, yeah, no, because I worked way too hard for that.
Wow.
So they just did local and finished and did it really quick, and I was able to leave.
Awesome.
And then as far as insurance, no, your insurance would absolutely cover the hospital. I've never seen anybody have a problem with that. It's just as if like you were, I mean, they don't know your plans for the home birth, so they would just think you transfer or you just went in or something happened at home accidentally.
There's another question about suctioning your baby after birth. Is it necessary?
No. So we all train neonatal resuscitation programs that are really, really extensive and really amazing. Usually we are never doing bulb syringe suctioning actually out of their mouths or anything like that. A lot of times we're doing postural drainage, if that's what they even need. But most of the time, like if baby needs resuscitation, it's just a couple breaths. And we always bring that equipment with us as well.
Okay.
So and usually I was just going to say it's not even, usually it's just a couple breaths and it kind of stuns baby and baby's like, oh, okay, and takes their breath. But sometimes they actually need, a good amount of work or transferring, but that's worst case scenario, obviously.
How come babies are suctioned so often in the hospital after birth? Like, it just seems like...
It is like a fear thing. It is just, I think, because they're just so trained to do that. I don't even know why. It's ridiculous. It's like they do it for everybody. Just like they do the eye goop and just like they do so many things just because it's to cover their own butts.
Yeah. And someone asked me a while ago about vitamin K with a home birth.
Yeah.
And I let them know, I don't think that you can buy shots for that for your baby and administer it, but you can buy oral vitamin K. And that is if you...
Birth I did 2 days ago, she had oral vitamin K and gave it to her baby. So you can do that. But I have had somebody who was a nurse themselves get the shot and give it to their own baby.
So can you get a prescription for that somehow? Is there a way?
I believe some doctors, sometimes they'll give them to you. Yeah.
That's really cool. I didn't know that.
I don't have like a name that I know right now of somebody who would, but I guess it depends on each doctor and the person.
Okay.
But for sure some will.
Do you see any more questions in the comments? Because we've answered all the questions.
Caitlin asked, what about birth certificates?
Oh.
So how was your experience with that?
It really wasn't that bad. It was kind of embarrassing because I had to go to the health department, and I'm like the only person in Caldwell County to have a home birth, I think.
Wow.
And I felt kind of nervous about it. Like, oh my gosh, are they going to call CPS on me? I don't know. I had all these questions about it, but they didn't, and they worked with me, and I got the birth certificate. I went to the Register of Deeds as well. I think that's where I started. And then I went to the health department, and I got it all done. So it wasn't, I think I was more nervous about the process than it actually was like difficult. Yeah.
It's not as hard as you think. You literally just go in. You don't have to mostly explain anything. You say, I had my baby at home and need to get a birth certificate. You don't have to give them the midwives' names. You just have to, usually they want a proof of pregnancy. Yeah. And that's about it. And a little bit of specific information about you and baby.
Yeah. So it's not as scary as you think it might be.
Right. It's a lot easier. So.
I think a lot of these things do seem really intimidating whenever you're starting to plan. But once you start covering everything and you just kind of check it off and write everything down that you want to do and plan for, I think that's really helpful. That's what I did. Like, this is everything I need to get in line and do before my baby gets here and then after baby gets here. So planning was really important for me.
Right. Yeah. I think that's like the whole theme for tonight, especially just there's a lot of fear about a lot of things, especially just pertaining to home birth, but what goes into it. And I guess just knowing that you have options, reach out to somebody. We want to talk to you. We're totally excited about home birth, and we love sharing and, you know, letting you know, hey, you know, it's not as hard as you think. It's not as bad as you think, and you definitely have options. So.
Yeah, I agree with that.
You're not alone, and we would love to work with you guys, and we understand everybody is in a hard situation right now.
Thank you for watching. Subscribe if you'd like, and I'll see you next time.